Setting, ward. You are talking to a son of 78-year-old man who was admitted to hospital following stroke 4 weeks ago. The patient has partial paralysis and has lost the use of his right arm. He is due to be discharged next week. 1. Find out reason for his request to see you. To give likely prognosis, fully recovery takes time, help, support needed, etc. 3. Find out details of father's living, arrangements, type of property, who with, stairs, etc. 4. Outline patient's care plan, occupational therapy, home and activities of daily living, physiotherapy, developing strength, mobility, etc. 5. Stress disadvantages of stopping physiotherapy, continued weakening of limbs, loss of independence, etc. 6. Stress the importance of patient's adherence to medication regimen, blood pressure and blood thinning medication, etc. 7. Find out any other concern. 8. Give information about support available. The setting is a hospital ward. We are talking to a son of 78-year-old man, and the son has requested to see you. So, we know the name of son. So we can start by saying, "Good morning. My name is Sarah. I'm one of the registered nurses working in this hospital ward. Let's assume their son's name is John, then we can ask him. Are you Mr. John? Probably son me tell you like, I am John. Then as per our first task we need to find out the reason for his request to see you. So we can ask question like, alright Mr. John, I understand that you have requested to see me. Is there anything specific that you would like to ask? Or you can ask, I understand that you have requested to see me, may I know the reason for your request? Then the son may tell you like, my father is admitted here and I have got information that he will be discharged next week. Shall I know whether he will be fine by this time? Then as per our second task we need to explain about his father's prognosis. For the fully recovery, it will take time. Till that time, we need to give him support. So we can tell him like it is quite understandable to feel worried about your father's condition. But I am glad to say that he shows good progress. For a full recovery it will take some time, he needs some time. So we need to give him time and supports. Is that clear? Then as per the next task, we need to find out the details of father's living arrangements. That is the type of property. Is he living alone or with you? Is there any stairs? So we can ask. Before proceeding further, can I ask you some questions to know about his living arrangements? So we can ask question like, may I know what type of property he lives in? That means is it a flat or villa? Then we can ask him, are you living with him? Then we can ask, what type of house he lives in, whether it is one-storied or two-storied. Probably he will be in his own house and the son lives far away. Then in that situation, we need to tell him, well, that would be a problem for him at this time. Try not to worry. We are here to help. There will be some measures to overcome this. Can I explain the care plan of your father? It is possible to get over with some measures that we have been giving here. And we have been arranging from here. Can I explain? For that, we need to explain about occupational therapy and physical therapy. So we can tell, like, Mr. John, your father has been undergoing occupational therapy that is to adapt activities of daily living. Also physiotherapy, that is to develop strength and improve his mobility. So you need to continue these things. These occupational therapy and physical therapy even after his discharge. Then probably the son may ask you, can I discontinue this physiotherapy? Then we need to explain as per our task. So we need to stress the disadvantages of stopping physiotherapy. So you can tell him, like, I'm sorry. We need to continue it because if he didn't, this might result in weakening of his limbs. As you know, his mobility is limited due to right side paralysis. So I highly recommend you to follow this physiotherapy, which would help him to regain his mobility. Otherwise, there may be chance of losing independence. If you do this procedure slowly, he can improve. And finally, he will regain his independence. Then as per our next task, we need to stress the importance of taking medicines. I would like to tell you there are two types of medication. There are mainly two types of medications for him. One is to reduce his blood pressure and the other one is to thinning of his blood. So I advise you to administer these two medication properly. We will give the instructions at the time of discharge. Are you able to follow me? And all these medicines to control his blood pressure and to reduce the clot formation. You can ask, do you have anything to share with me? Then, probably as per the interlocutor's card, he may ask you, I don't know. How did he manage this? Then we need to explain about the support groups which are available for him. We need to tell him, like, all right, Mr. John, I really understand your worries and your concerns are reasonable. They can say we have support groups available to give him assistance. They will visit your father every day and would help him in every step. How does that sound? Probably the son may agree with you. Then we need to find, do you have any other questions to share with me? If there is nothing, then we can tell him, like, I hope I have cleared all your concern. Please contact me at any time if you have any further queries, and I wish your father a speedy recovery.